A really important point. I think one of the real signals with monkeypox is not so much the outbreak itself, but it's a reminder that in today's world, in a globalized world where climate change is affecting the spread of pathogens and we all move around a lot more, that just because we had what we called a once in a century pandemic or are still experiencing it, doesn't mean it'll be another century or anywhere close to it before other pandemic threats emerge. And so we really need to understand that the world has changed over the last 20 years. And so all the investments that we've made and the things that we've learned over the last few years with SARS-CoV-2, we need to keep that infrastructure in place, the ability to do surveillance against emerging pathogens, and to have swift public health responses. We've seen over the last couple of weeks as the monkeypox outbreaks have spread has been rapid genomic sequencing. What that's told us is that the virus that's circulating now looks very similar to a predominant West African strain from a few years ago, which suggests that there has not been a new mutation which is making it more infectious or more dangerous in some way. Now that's early evidence, but certainly it's reassuring. So I think that, again, what we've seen in the UK has been an aggressive strategy to isolate people who are infected. I think more widespread communication to recognize the signs and symptoms of the disease, which again looks a lot like chickenpox, ring vaccination strategy, and there are some treatments available as well that can be deployed if necessary.
Peter, I was talking to CEPI, which is, of course, the Coalition for Epidemic Preparedness Innovations out in Davos. And they pointed out that, look, even if monkeypox isn't anywhere near as dangerous as coronavirus, our preparedness is just nowhere near where it should be. With coronaviruses, we already roughly knew how to treat them once we got the identity, the DNA of this particular one as well. But in terms of, because we had experience with SARS and the Middle Eastern flu virus as well. But the fact of the matter is there are a lot of other illnesses and diseases which, because of globalization, will be proliferating, and actually our preparedness is very, very low globally going forward. Are we failing to learn the lessons of the coronavirus pandemic?
Yeah, it's exactly the point that I was making, that this is a new and different world, and so we need to have levels of preparedness much higher than I think we have. We were caught asleep at the wheel a bit with COVID-19, and what I worry about is that a lot of our responses that were kind of emergency responses with COVID-19, to an extent, have been dismantled as we've sort of moved forward, and we do need to invest a lot more at the global level and then also at the country level in disease surveillance. So there are a number of families of pathogens that could potentially, say, jump from animals to humans and emerge as a new epidemic or pandemic threat, that we need to really accelerate our ability to move from the identification of a pathogen to the development, testing, and deployment of vaccines. There's something called the 100-day project, which tries to reduce the time it would take to develop and get a new vaccine out there for a new emerging disease to 100 days. But then the other thing that we need to do is make sure that every country has robust plans and infrastructure in place, not only to do the surveillance, but also to respond clinically and from a public health perspective. We have to remember that the next pandemic threat can come from anywhere, and so it makes us safer in the UK or in Europe if we make sure that infrastructure is robust in West Africa and Southeast Asia and around the world. And that's where global cooperation, where we've sometimes, I think, really struggled in COVID-19, needs to be more robust.